Hello and welcome to this presentation on discussing the health record and its clinical documentation. Regardless of the healthcare setting, accreditation and regulatory standards require a separate record for each individual patient. The various standards address the minimum documentation requirements. There are many functions of the health record of a patient, to include serving as the principal communication document among providers who are caring for the patient at different times and in different locations. For billing and reimbursement, medical claims will not be paid by an insurance company if the patient record does not reflect what was done to the patient to support the claim. The record is a legal document if needed to become evidence in a court of law. It is used to develop patient care plans, improve the quality and processes of healthcare delivery. It is used for public health reporting. Each state defines information that must be collected for public health activities such as disease prevention. For research, if a patient is involved in a clinical trial, monitor the effectiveness of new devices or new drugs. There are also many users of the health record: clinicians responsible for direct patient care, staff working in non-clinical roles such as health information management professionals, student interns in ancillary departments, and medical students, coding and billing staff, patients and their legal representatives, quality improvement organizations, insurance companies, government payers, and many other organizations. Who owns the health record? Some seem to think this is a gray area. However, it is very clear. The medical record is the property of the provider, as governed by federal and state laws. The patient has a right to access the record to review it. The provider owns the documents and maintains possession of the original records. The provider can also choose how they wish to store the records. No matter what media a medical record may be in, the provider is still responsible for keeping that record based on statutory requirements. The patient owns the information contained in their health record. They must ensure the information they provide their physicians and caregivers is accurate and correct. The Health Insurance and Portability Act, or HIPAA, for example, defines how patients have a right to request their records be amended if information has been recorded incorrectly. If a provider refuses to honor a patient's request to amend their records, they still must keep a letter stating such in the patient's medical record file. Anyone that works in healthcare has an obligation to protect the confidentiality of a patient's protected health information, or PHI. PHI is any information that uniquely identifies an individual, such as by name, medical record number, account number, social security number, home phone number, and address, just to name a few items. PHI cannot be given out to or released to any individual not involved in the care of a patient. Only those authorized may obtain copies of PHI. Release of information is the process by which the Health Information Management Department must document each request for patient PHI. They are also responsible for verifying that each request is valid. This includes all mail documentation as well as faxed information. PHI needed for treatment, payment, or operations, or TPO, at a healthcare facility does not need patient consent. All other releases the patient must consent to by signing a patient authorization for release of health information. Who can document in the health record? This is defined by state laws, federal laws, accreditation standards, licensing requirements, facility policies, and facility rules and regulations. Most physicians, nurses, and allied health professionals are permitted to do so. A facility must also define what their legal health record is and what it will contain. With records in different forms across different systems, it is important to have a definition as to what is constituted as a legal record in an organization. For example, an electronic health record can have multiple versions and different features to view information not available in the paper form of records. Defining a legal record is very complex. Different healthcare organizations will have different definitions. Regardless of what form the record is kept in, the health record must represent the legal and business needs of the organization. Legal management of medical records is an important process. Medical records not only serve for the care of the patient, but for business and legal reasons as well. The legal health record may be requested for a court case, government audit, or by an accreditation agency. Questions an organization can ask to help determine what their legal record will be are: 1. Will the legal record contain just clinical data? 2. What types of demographic data will it contain? And 3. Will any administrative data be contained in the legal record? The answers will be different for each facility that collects, stores, and transmits patient data and medical records. As stated previously, different entities establish who can document in the medical record. Those given the right to document in a medical record are responsible for documenting the care, treatment, and services rendered in a manner that complies with all policies, state regulations, and accreditation requirements. It is important to note that all services rendered to a patient must be documented to prove that the best quality of care was provided. Inadequate documentation will cause the continuity of care to be compromised for the patient. All medical record entries require authentication, which means they are signed, dated, and timed by the provider. This can be done in a variety of ways as defined by the facility itself. In addition, abbreviations that are not approved for use by the organization cannot be used in the medical record. All entries in the record must be legible. This will not be an issue as organizations move toward an EHR. For traditional patient records or hybrid systems, all handwriting must be clear and be able to be read by everyone involved in the care of the patient. All entries must also be timely. This means documentation should be performed immediately. A clinician cannot wait until the next day or the next shift to document in a medical record. It must be done timely so all accounts can be recorded accurately. The future of the medical record is going to be a fully integrated EHR for all healthcare organizations. Organizations such as the National Committee on Vital and Health Statistics and the National Health Information Network have played a major role in supporting EHR adoption. They have both been involved in the creation of data standards and functional as well as technical requirements that are needed for future EHRs. Health Level 7, or HL7, is an organization that developed and continues to maintain the leading messaging standard used to exchange clinical and administrative data between different healthcare computer systems. It passed the first approved standards for the functional requirements for an EHR system back in February of 2007. HL7 specifications are independent of any application or vendor. This means applications that can send and receive HL7 messages can potentially exchange information. If a hospital has one vendor system for the lab, for example, and another vendor system for registration, transferring patient information from one department to another is easily done with HL7. HL7 also is the primary standard for the communication of orders, lab results, radiology reports, vital signs, and many other types of clinical data maintained in the patient's medical record. An EHR helps to facilitate the creation of a longitudinal patient record. This type of record contains records from different sources that are linked together to provide a view of a patient's medical history over time. It also helps with clinical decision support, medical alerts, and analysis of patient diagnoses, treatments, and illnesses. The longitudinal record will work best with an EHR and work just like a personal health record. This concludes this presentation. Thank you.